Okay, this is the video competency for skin prep in MA 180. Step number 1 says to wash your hands and gather your equipment. So you will go to the other room, do a medical aseptic hand wash, and then you're going to gather your equipment, which is listed at the bottom of your competency sheet. So that equipment includes a skin prep pack that you are going to wrap to make sure it's wrapped the appropriate way. So the items that should be in there are listed on your comp. It's the 3 bowls, a sponge forceps, gauze, a fenestrated drape, etc. You also will need a suture kit. So there's 3 things that go into a suturing kit. It's a scissors, a needle holder, and a tissue forceps. So you're going to put that in a pouch, and again, you're responsible for wrapping that prior to your checkoff starting. You'll also need suture material, which will be in your skin prep box that's in each curtain. You'll need sterile water, sterile betadine, a non-sterile discard bowl, a sponge forceps wrapped individually, left out here on your side table, a sterile drape wrapped individually, left out here on your side table, and sterile gloves to put on. Okay? You'll also need 2 Mayo stands. One is going to be your sterile field. The other one is going to be the stand for your patient to rest their arm on. Okay? So I have all of my items gathered together. The next thing that I'm going to do is I'm going to go ahead and set up my sterile pack. So I'm going to use the tray. That's going to be my sterile field. I need to make sure that my tray is not at waist level but above waist level. So you have to adjust your tray to fit yourself. So the first thing I'm going to open is my sterile pack. We always want to open away from us. Every time we open a sterile instrument, we always open away. That way we don't have to reach over it once that sterile pack is open. So see how I'm pulling that away from me? And I want to keep this sterile tray as close to me as possible because there's a lot more space on this side to cover my tray than there is on this side. So if I don't want this up here, I might run out of room here at these corners. Okay? So I'm going to pull this straight here. And then I'm going to do one side, then the other side, then the side that's closest to me. Anything that falls down now off the edges of this tray is considered non-sterile, okay? So there's that 1-inch border that's kind of the gray area. I want to work more towards the center of my tray as much as possible, but that 1-inch border is kind of the gray area. So I can't pull this over because this non-sterile area can't become sterile just because I pull it up. Once it goes over the edge, it's gone, okay? So I have my pack opened. The next thing I'm going to do is open my suturing kit. Now this takes a little bit of finesse because we're going to open these instruments and we need to make sure they don't fall off the edge or hang off the side. So I'm going to open my pack just a little bit, pulling backwards, and I want to try again to utilize the center of my sterile field. So those are all dropped on there. Next I'm going to open up my suture material. So the material I'm going to pull down, open it up just a little bit, and get it to drop out of my pack as well without contaminating. Okay, so now I have everything that I need sterile opened onto my sterile field, but I need to go get my patient and do a couple other things. I cannot leave my sterile field unattended, and every time I go to get something, you don't want to turn your back. You want to take a step back, keep your hips open so that you can see your sterile field in your peripheral vision or your direct vision. So like I said, I have everything dropped on there. So the next thing that I'm going to do is I'm going to take my sterile drape. I'm going to open it in the air in the proper way and cover my field so I can go get my patient. So again, we're always going to open away from us first, not down here, but above the waist. One side, then the other side. And I'm going to hold on to this last spot so that I have control of that drape. Okay, my last flap I'm going to pull back. This again is all non-sterile now, so I can pull it back if need be, if I need to drop it onto the field. But I'm going to cover the field with it. So remember from my previous videos, you have to have this corner out so that you can grab that edge. If that corner is folded in, you're not going to be able to grab that edge. Again, that edge meaning that 1-inch border of this drape that's kind of my gray area. So I grab just that one little corner and I'm going to pull up so that it doesn't drop below my waist. Now what I want to do is grab another edge, and I have control of my drape, and I have to kind of see, I can't drop my drape down so I can see to cover my field and come back up. It's got to come from up and come downward. Does that make sense? And cover my sterile field completely. I want to start closest to me and cover away. That way this keeps a barrier between my sterile field and myself, which is non-sterile, okay? When I uncover, I'm gonna do the same thing. I'm gonna come from this side and uncover this way. I don't want to uncover this way because see how that reaches over the sterile field. So my field is covered and I can move it and I can touch it because all the sterile stuff is all covered up and yummy and goody. Okay, so now I'm gonna go ahead and get my patient. Jessica? Oh, hi Jessica. We're gonna go ahead and have you have a seat right up here today. The doctor wants us to go ahead and get you ready for your wound to be sutured up, okay? Can I get your birthday?
6485.
All right, perfect. That's what I have in your chart as well. I'm gonna go ahead and put your arm up on this table and get it situated comfortably. So you do want to confirm your patient's date of birth, and then you want to adjust the tray so that it's comfortable for your patient. Do you mind putting your arm up there? The one, oh yeah, we're gonna suture up that wound. Do you want a little higher, lower? What's comfortable for you? Are you sure you're gonna be like this for a little while?
Mm-hmm.
You good? Okay. So you want to make sure that your patient is nice and comfortable during this process because, again, it's going to take a while. The doctor is going to come in, numb up that wound, and then it's going to have to wait until that takes effect, and then, you know, we're going to scrub it and suture, bandage, etc. So make sure your patient is comfortable. So she's set up. The next thing that I want to do is I want to bring my tray over. So, again, I don't have to turn my back on it. So I want to position it in a place that's comfortable for me. I'm gonna uncover my tray and then I'm gonna get ready to pour my liquids, okay? So again, I'm gonna reach across because this is non-sterile, uncover my tray, never turning my back on the tray. And before I pour my liquids, I'm gonna have to get my bowls up. See how my bowls are nested in that kit? I need to remove those bowls so I can get liquid in 2 of the 3 of them. So that's what the extra sterile sponge forceps is for. Again, opening it in a sterile manner, not over my sterile field, but to the side, above my waist, starting away from me, then each side, then closest to me. Now what I can do is put my fingers in the ring handles and the distal part of my sponge forceps is still sterile. So I'm gonna reach down, I'm gonna pick up one of my bowls, and those are the bowls that I'm gonna pour my liquids in. I'm gonna scooch that over so that my bowls can be closer to me when I pour liquids and I don't have to pour liquid over the sterile field, okay? So that's all I need to manipulate for right now so I can get rid of my sterile transfer forceps. And the next thing I'm gonna do is pour my sterile liquids. Okay, the proper procedure for pouring sterile liquids. There's a label. You want to have the label in your palm so that when you pour, if there happens to be some dribble, it doesn't dribble over the label and you can't read what the liquid is. So you take off the lid. Don't squirt out a little hole if you have a squirty bottle. Take off the lid, set it down cap side up so you don't contaminate the inner side of the bottle. And with the label in my palm, I'm going to pour just a little bit, just a drip or 2, off to cleanse the side. And with this betadine, it's nice because you can kind of see how it cleanses that whole side of the inside of the bottle. Pour it in there. And now I'm going to come over to my sterile field without dripping on my sterile field. Label still up. I'm going to pour a little bit of betadine into one of my bowls. I don't need much, just a little. Then I'm going to come back, put the lid on my bottle. Same procedure for the water. Okay, so I'm going to put the label in my palm, cap off, lid side up, a drip or 2 into my non-sterile discard bowl, and now I'm going to pour a little water into my other bowl on my sterile field. And you see how I'm walking back and forth this way? I'm not turning my back on my sterile field. Now I have everything on there that I need, and I don't have any other non-sterile things that I need to do, so I'm going to put my sterile gloves on. I'm going to sterile glove over here on this table because it's above my waist, but I don't mind if you sterile glove behind your patient as long as you can still see your sterile tray, okay? So for this part of the checkoff, if you mess up any of your sterile gloving, it's an automatic fail because you've already checked off on your sterile gloving. So keep that in mind, and you should always continue to practice your sterile gloving. So first thing I'm going to do is open up my glove package, making sure that it stays open. Take a step back, simulate, the only hand wash you're allowed to simulate, pretend surgical hand wash, and then put on your sterile gloves in sterile fashion. Escaped before that closed on me, thank goodness. Again, wrists need to stay above elbows. You want to make sure you get all your fingers in the right finger holes, which is not happening for me without touching anything other than, there we go, that cuff. First one on, pick up my second one, and I'm going to come over here because I'm done with that sterile field. Now my hands are sterile as can be, so I can touch my tray. And I'm going to get my tray set up now. So there's my other discard bowl. I got my liquids here. I want to take all my gauze, put it on a pile, put my fenestrated drape on a pile, and I'm going to get rid of this tray because it's just really kind of in my way. I'm going to take all my instruments out, my suture material that I dropped onto my sterile field, put all these instruments out here that I need, and this bulky tray, I'm just going to step back and I'm going to drop without lowering my hand. I got to keep my hand up so it gets kind of loud when we do those drops. So I dropped it from afar. Now, if I start to scrub on my patient, you see how I might come here, I can't see my sterile tray. So I'm going to move my sterile tray a little bit forward, keeping my hands up at all time and being careful as I move my tray nice and fluid and gentle so that my liquids don't spill and contaminate my sterile field, because those liquids, anything wet on your sterile field is a contamination. So I'm going to take just 2 4x4 gauze, fold them in fourths, and I'm going to put them in my sponge holder, okay, my sponge forceps, excuse me, okay. So now I'm going to dip them in the betadine. Patient, are you allergic to betadine? No. Okay, great. Always good to ask that. And I'm going to scrub on my patient's skin up and down and back and forth for 2 to 5 minutes. This is really going to clean the area, so this would be the area where she would have the laceration or the wound, okay? Make sure you physically go up, down, back and forth, and make sure you do it for 2 to 5 minutes. And what I'm going to do next then is I'm going to use my sterile discard bowl to get rid of this sponge that has betadine on it. So I'm going to open that into my discard bowl. I'm going to set my sponge forceps down. I'm going to pick up my sterile water. This is going to be really cold. Let your patient know it's going to be chilly, and we're going to rinse that area. Set my water down. I'm going to save at least 2 sponges to do my next scrub. So I'm going to take my other sponges and I'm going to dry the area. Now I have to be careful not to get my gloves wet, because then my gloves would no longer be sterile, they would be compromised. Okay, so I'm going to take those, put them in my discard bowl as well. Take my last 2 sponges, fold them in fourths. Now the first time it didn't really matter how deep I put them in my sponge forceps. This one does matter. So if I barely put them in on the edge here and I have all this extra, see how floppy that is? And I don't have control. On this second scrub, you really need control, because you're going to start in the center and work your way out without going over any area. So I want to put them closer to the tip. So see, I have more control over this tip. I also want to make sure I'm using the tip that has the finished edges, not these unfinished edges, because again, you see how that's less control. It's just kind of hanging out all over the place. So I'm going to dip in betadine again, keeping my hands up at all times. And I'm going to start in the center, and I'm going to work my way out without going over any area. And when you do the scrub, it doesn't have to be, you don't have to scrub the whole arm. It's just a little bit, just an inch beyond the edges of the wound is what we're looking for. I'm going to get rid of that sponge. And what I'm going to do next is I'm going to pick up my fenestrated drape, making sure it doesn't drop below my waist, and I'm going to drape the patient's arm, making sure the opening of that fenestrated drape is right over the center of the area. What that does is it allows this whole area here to be sterile, to be a sterile field. The provider can come in and set items on here instead of the sterile field. And so the only thing exposed that's living is the patient's skin, because we cannot sterilize skin. Now the last thing that I want to do, I as an MA have prepped the patient's arm. The provider's going to come in and do the suturing. So I want to get the suture material ready for my provider. So what I'm going to do is I'm going to set up the instrument handles to the edge. okay? And I'm gonna take the needle holder, I'm gonna place the needle in the needle holder. So the needle is curved for suturing. That lessens scarring. So we don't have to go straight. And see how, I don't know what kind of background it would be best for you to see. See how the needle is perpendicular to the needle holder. It's like a 90-degree angle. Okay, so here's my needle holder, the needle comes out the side, and the provider is going to take that needle and lift up the skin this way. So kind of do that in your hand to make sure you have your needle in the needle holder correctly. So the needle's in the needle holder, I have my tissue forceps, I have my scissors, and I have my sponge forceps. They're ready to go. So now what I'm going to do as a medical assistant is I'm going to step back and I'm going to let the provider go ahead and suture the wound. That's his job or her job. I'm going to assist in any way. So typically what a medical assistant will do to assist is the provider's going to tie the knots, and we'll take the scissors and we'll cut after they tie a knot, and then they'll tie another knot and we'll cut, and we'll do the bandage afterwards. We'll do whatever they need us to do throughout that procedure, whether it's get another instrument or whatnot. So I may ask you some questions during this point, like when we're finished, where does the needle go? So your answer would be the sharps container. What's an acceptable border on your sterile field? Your answer would be 1 inch. If I am standing over here, can I grab this like this in this manner? Your answer would be no. You need to kind of come around so you don't reach over your sterile field. So I'll ask you a handful of sterile principles just to make sure that you know the difference between sterile and non-sterile, and how those two pieces work together. Okay, so that'll be the end of your checkoff then, but do make sure you take your gloves off properly. So you're gonna grab the palm like you've seen in the other videos, make sure that glove comes off completely inside out, wad it up in your other hand, go along your skin, and this will go, might be one of the questions I ask you in biohazard. Okay.